This conference will now be recorded.
We are the Team Media Managers. I'm Gabrielle Thierry. This is
Deborah DePinto.
and
I'm Danielle Ashway.
This is for our group education project. So for our case, Elizabeth Smith is a 27-year-old female who is with her roommate Jenny. Elizabeth was diagnosed with bipolar 2 disorder 2 years ago, following a hypomanic and major depressive episode. Following this diagnosis, she was prescribed regular release lithium, 600 milligrams by mouth, twice a day. Since then, her symptoms have decreased and have been controlled. Unfortunately, the medication caused her to experience the side effects of weight gain and chronic fatigue. Elizabeth has gained 30 pounds in the last 2 years and cannot seem to take the weight off. 2 months ago, Elizabeth decided to stop taking her medication without consulting her physician. Elizabeth feels that if she stops taking her medication, she can lose the weight, have more energy, and her symptoms of bipolar 2 have been under control long enough. Within 2 weeks of Elizabeth coming off her medication, Jenny notices Elizabeth's moods have strayed from her usual bubbliness. Jenny noticed that Elizabeth has been crying in her room. She has not been showering every day, often wearing the same sweatpants, has been lethargic, agitated, and has been going to bed around 3 a.m. and waking up around 5:30 a.m. Over the last month and a half, Jenny did not think much about the changes in Elizabeth's behaviors since she knew Elizabeth had been under a lot of stress lately. Elizabeth's job has been very stressful, and she and her boyfriend went through a breakup about a month and a half ago. When Jenny woke up today, she found Elizabeth sitting on the kitchen floor sobbing, rocking back and forth with a knife in her hand. Elizabeth was saying she doesn't want to live anymore because living is terrible. Jenny immediately called 911 and explained the situation. The 911 operator was able to give Jenny some advice on how to talk Elizabeth down. After some time, Jenny was able to take the knife out of Elizabeth's hand, and the police arrived at the scene. Elizabeth agreed to go to the hospital with the police. Elizabeth was admitted to the psychiatric unit at Lehigh Valley Hospital, Muhlenberg.
Hi, Elizabeth. My name is Madison, and I will be your nurse today. Can you tell me what brought you here today?
I just don't feel good. I've been feeling very sad and out of control. My roommate Jenny found me holding a knife this morning, and I was thinking about killing myself.
What do you think is making you feel like this?
I was diagnosed with bipolar 2 disorder about 2 years ago, and I was put on medication. I really don't like the side effects. It's made me gain weight, and it makes me feel very tired. I've also been feeling better, and I don't think that the bipolar symptoms would reoccur, so I stopped taking my medication.
It is great that the medication was working for you, but those side effects must have been really difficult to deal with. Can we discuss together with your doctor about finding a different medication that will suit your needs better? Can you tell me more about the symptoms you have been experiencing since you stopped your medication?
Lately, I just haven't felt very motivated to take care of myself because my energy is low. I've been very emotional. I haven't gotten much sleep because I went through a breakup. My job's been really stressful lately. The whole situation's been making me feel very irritated. Since the breakup, I also haven't had much of an appetite or been able to concentrate much because I've been in such a funk.
Those seem like events that could trigger your symptoms of bipolar 2 disorder and cause them to resurface.
This is the worst I've ever felt. Before my diagnosis, I had a few days of high energy and mostly depression, but never anything like this. This time I was overwhelmed.
Okay, let's talk to your doctor about your medication, as well as working together to develop a care plan to alleviate some symptoms you are experiencing. What do you think of this plan?
I think this sounds good, but I'm concerned about the side effects of any new medication I take.
I understand that you are concerned with adverse effects of any new medications. We will discuss this with your doctor. For now, I'm going to put together my notes on what we discussed, and I will come back in a half an hour.
Nurse Madison reviewed Elizabeth's chart and came up with the following nurse diagnoses: risk for violence, self-directed total self-care deficit, ineffective individual coping, and impaired social interaction. Nurse Madison then returned to Elizabeth's room a half hour later to collaborate on which goals Elizabeth wanted to accomplish during her stay at the hospital.
Elizabeth, let's talk about some of the goals that might be effective for your time in this facility. The first step is to determine our most important goal, and that is to keep you safe from injury. How do you feel about this goal?
I don't really want to hurt myself. I know now that being off my medication led to this, but I agree that this should be the highest priority.
Hopefully, altering your medication with supplemental therapies will help you with symptoms. That being said, once we adjust your medication, it is very important that you comply with your medication regime. How do you feel about this goal?
Well, I know that the medication worked in the past, so I would like to stick with it this time. I just really hope that the new medication doesn't cause the same side effects. But if they don't, that would definitely help me stick with the assigned medication schedule.
That's good to hear. Our next goal that I would like to talk about is performing basic activities of daily living. This would include getting out of bed, taking a shower, brushing your teeth and hair, getting dressed, and eating 3 meals a day with light snacks.
Since we've been talking and since I arrived, I know that it's going to take some time, but I feel that with my motivation and time, I'll grow even stronger, and hopefully this medication works for me.
I'm so glad to hear that you're feeling more motivated to do better. The last goal to strive for during your treatment will be finding 1 or 2 solitary activities that can relieve some tension by minimizing any escalating emotions. Examples of these activities we can have you try is journaling, reading, listening to music, making art. Would any of these goals be good for you?
I think that relieving tension would be helpful since I've been under a lot of stress. I like to exercise and listen to music when I was feeling more like myself.
Hello, Elizabeth. I'm Dr. Phyllis. I talked with Nurse Madison earlier, and she mentioned that you requested for your medication to be changed due to the side effects. I looked over your chart and have decided to change your medication and made an order for carbamazepine Acutril. This will be administered every 12 hours to treat your bipolar II disorder. I have scheduled that your order be refilled weekly so we can evaluate if the medication is working for you. Following discharge, I like to see you attend a partial hospitalization program so we will be able to monitor your progress. How does this sound?
What's a partial hospitalization program?
Sure. A partial hospitalization program allows you to return home, but your attendance will be expected in a facility Monday through Friday from 9 a.m. to noon for approximately 1 to 2 months. But we will reevaluate your progress after 3 weeks. In this program, you will attend group therapies, individual therapies, and will work on skills building activities. We will also evaluate your medications. This is the general idea of it, but you'll find out more once you attend. Do you have any other questions?
No, thank you so much, Dr. Phyllis. I appreciate everyone working together to help me. It's been an uphill battle taking the lithium, and I really hope to see better results with the new medication.
You're welcome. We want to see you get better. I will be back to see you tomorrow, but if you have any questions, don't hesitate to ask Madison to page me. Nurse Madison also leaves Elizabeth's room and works to establish supporting interventions to help Elizabeth achieve the goals and outcomes. Madison's interventions included frequently assess client's behavior for changes of agitation and hyperactivity, patient put on one-on-one observation and re-evaluate every 24 hours, encourage patient to partake in stress-reducing activities, administer medication when indicated, avoid giving the client caffeine, monitor intake and output and vital signs, Maintain a firm, calm, and neutral approach at all times. Observe her destructive behavior towards self or others. When less manic, the client might join one or two other clients in a quiet, non-stimulating activities, and when possible, provide an environment with minimal stimuli. Lastly, administer any anti-manic medication and per needed tranquilizers as ordered, and evaluate for efficiency and side effects and toxic effects. Nurse Madison implemented these interventions and adjusted her care plans throughout Elizabeth's time in the facility. Elizabeth's condition gradually began to improve daily. By day 14 of the treatment, Elizabeth's condition had improved enough that she was ready to be discharged to the partial hospitalization program to continue her treatment, which would be further evaluated after 3 weeks.
This conference will now be recorded.